Hello, my name is Ramona Nedova. I'm a third-year student in the English program at MEV. I'm Bulgarian who was born and raised in Chicago, Illinois. I've always wanted to study medicine due to its intriguing complexity and how every single disease is similar but yet different based on the patients. I've spent my whole life translating Bulgarian to English and vice versa. One of my passions is teaching my colleagues about our Bulgarian traditions, culture, and history. Speaking of colleagues, I have a few to introduce to you today from Group 18, which have brought presentations on medical topics to spread awareness. Joel has grown up in the UK. Both of his parents were nurses, which meant that he was surrounded by healthcare from a young age and decided to dedicate his life to it. In school, he had always been interested in topics like biology and how the human body worked. He currently doesn't know what he wants to specialize in, but he's keeping an open mind to see what truly fits his interests and strengths. His favorite memories in Bulgaria is exploring our culture and making lifelong friendships at our university. The topic that he'll be telling us today about is something that he finds very relevant, interesting on an academic level.
Hi, and welcome to my presentation on gout. So what is gout? Gout is a type of inflammation of arthritis caused by the buildup of uric acid crystals in the joints, leading to severe pain and swelling. So common symptoms can be intense joint pain, often in the big toe, redness and swelling in the affected joint, limited range of motion in the joint, and recurring flare-ups. So causes of gout. So the main causes of gout are hyperuricemia, which is excess uric acid in the blood, which forms sharp crystals in the joints. Dietary factors, so high intake of purine-rich foods, such as red meat, seafood, sugary beverages, and alcohol. Other risk factors could also be genetics, so family history of gout increases risk. Gender and age, so men over 40 and postmenopausal women are more prone to gout. Obesity and metabolic syndromes, and chronic kidney diseases. So populations which are most affected by gout. So global perspectives is that gout is a prevalent worldwide disease, but some populations have higher rates due to genetic, dietary, and lifestyle factors. So countries with the higher incidences are New Zealand and the Pacific Islands. Highest global rates are particularly among the Maori and Pacific Islanders. Also, the United States, which have about 4% adults, and the United Kingdom, which approximately has 2.5% of the population. Demographic factors, so as mentioned previously, men. So gout affects men, especially in the age between 30 and 50, and in women who have postmenopausal, and they are more increased risk of getting gout. And also ethnic groups such as Black and Pacific Islander populations. So government policies in action. So in New Zealand, it focuses on the Maori and Pacific Islander communities through tailored health interventions, culturally appropriate care, and community outreach programs. In the United Kingdom, they have the NHS Gout Management Plan, which includes early diagnosis, medication access, and promotion of healthier diets. In the United States, initiatives to reduce obesity and improve diet through health education campaigns targeting high-risk populations such as African American communities. So government initiatives to control gout. So in terms of healthcare interventions, there's public awareness campaigns. So the government in New Zealand, in the UK and US promote health lifestyles and diet awareness to prevent gout. These programs focus on reducing purine-rich foods, promoting physical activity, and limiting alcohol consumption. There are also subsidized medication. So many countries, they provide subsidized gout medication like allopurinol and colchicine to help lower the uric acid levels and manage flare-ups. Research and guidelines as well. So development of clinical guidelines to improve the gout diagnosis and management, as well as support for research on gout, its causes and potential for new treatment. Programs for higher risk groups, such as targeted health programs for population at higher risk, such as the Maori and Pacific Islanders in New Zealand, that offer free healthcare checkups, dietary and lifestyle counselling and education about management of uric acids. So preventative measures for gout. So the initial ones are dietary modifications, which is to limit red meat, seafood and sugary drinks, and especially reduce alcohol consumption, especially beer, and to encourage intake of low-fat dairy and vegetables. So lifestyle changes could also include weight loss and regular exercise, as well as drinking plenty of water, staying hydrated, and to manage other health conditions such as hypertension and diabetes. So complications if untreated. So the first one is chronic gout. So this is where there is an ongoing inflammation which can lead to permanent joint damage. The joint may become deformed over time, affecting mobility and quality of life. Also, frequent flare-ups may lead to joint erosions and destruction on visible X-rays. Tophi formation. So without treatment, tophi, which are lumps of uric acid crystals, can form under the skin around joints, which cause pain, stiffness and deformity. They can also occur in areas like the ear, fingers and elbows, and may become infected or ulcerated. Another thing could be kidney stones. So uric acid crystals can build up in the kidneys, leading to kidney stones, which can cause severe pain and potential kidney damage. Chronic kidney disease, over time, untreated gout can cause chronic kidney disease and impair kidney function. Also, increased risk of cardiovascular disease. So studies have shown that untreated gout is associated with a higher risk of heart disease, hypertension and stroke. So metabolic syndrome, this is where the gout is commonly linked with obesity, diabetes and high cholesterol, which are all raise cardiovascular risks. So current treatments for gout. So medications to manage uric acid. As mentioned before, we have allopurinol. So this is the most commonly prescribed medication to lower uric acid production, safe for long-term use and helps prevent flare-ups. We also have febuxostat, which is similar to allopurinol, but often used when patients cannot tolerate allopurinol due to the side effects or kidney issues. Another medication could be probenecid. So this helps the kidneys remove the uric acid from the body, often used for patients who underexcrete uric acid. Anti-inflammatory medications for flare-ups. So colchicine. This is used to reduce the inflammation and pain during acute attacks. NSAIDs, which are non-steroidal anti-inflammatory drugs. So you can buy them over the counter medication like ibuprofen and naproxen, and which helps reduce the pain and swelling. Corticosteroids, which are oral or injectable steroids like prednisone, can be prescribed if other treatments aren't effective or tolerated. Biological and new treatments, such as pegloticase, which is an IV infusion used for patients with chronic gout that doesn't respond to other treatments. It breaks down the uric acid crystals. Another is canakinumab, which is an experimental anti-inflammatory biological therapy targeting interleukin-1, which plays a role in gout inflammation. So demographic of the age affected by gout. So as mentioned before, men aged between 30 and 50 are most commonly affected due to higher uric acid levels, and menopausal women increased risk of having gout due to lower estrogen levels, which normally help reduce uric acid. Also, adults who are above the age of 60, the prevalence has risen significantly, affecting up to 10% of men over 60. Also, children and young adults is rare, but possible cases with genetic disorders or kidney issues. These are my references, and my conclusion and the given key takeaway points are that gout is a common but manageable condition if diagnosed early and treated with lifestyle changes and medication. Certain population, especially men and specific ethnic groups, are at higher risk. Government interventions such as public health campaigns and subsidized treatments are crucial in managing and preventing gout. Thank you.